Hi, in this video I'm going to be teaching you how to care for your baby's umbilical cord stump after they're born. If you're new here, welcome to my channel. My name's Anya and I'm a hypnobirthing practitioner. My YouTube channel's here to support you on your motherhood journey, so please consider subscribing and clicking the bell icon so you don't miss my weekly videos. I bring out a new one every single Tuesday. After your baby's been born, their umbilical cord will be clamped and cut to separate them from the placenta. A clamp will remain at the end of your newborn's cord stump until it's dried out. It's usually fully dry 2 to 3 days after birth, and your midwife or doctor can remove the clamp for you. Initially, the cord stump will look white and a little bit shiny, but as it dries out, it can turn brown, grey, or even go black, and all of this is perfectly normal, and usually no problems will develop so long as you keep that area dry and clean. The umbilical cord stump will usually fall off 1 to 3 weeks after birth. In the meantime, please don't pick at it or try to pull it off before it's ready to detach naturally. To help look after your baby's umbilical cord stump and navel area, prevent infection and avoid any accidental snagging or tearing, you need to be mindful of a few main things which I'll share with you now. So my first tip is to fold the top part of your baby's nappy or diaper down and in on itself so that it isn't rubbing on your baby's umbilical cord, and this ensures that it's sitting comfortably underneath your baby's belly button. My second tip is to make sure that any clothing that your baby's wearing is not pressing on their belly button area. So avoid dressing your baby in any trousers or shorts and stick to baby grows instead. So long as your baby is warm enough, it's a good idea to let air get to the cord stump area each day because fresh air helps with the healing process. Once a day, you can gently clean around your baby's belly button area. All you would have to do is put a little bit of warm water on a cotton swab, a cotton pad or a cotton ball, then slowly clean around your baby's navel. Just make sure that you don't get the umbilical cord stump wet. Now if your baby has a bit of a poop explosion and some of the poop rises above the level of the nappy and spreads onto your baby's stomach area, you can do an extra clean with some warm water around your baby's belly button to prevent any bacteria from entering the navel. It's recommended if you avoid placing your baby in a bathtub of water until their umbilical cord stump has completely fallen off and their belly button area has completely healed. You can, however, give your baby a sponge bath and clean their hair, face, neck and bottom area if they've got grubby from feeding or pooping. If your baby's cord gets accidentally wet, don't worry about this. All you need to do is gently dab that area with a dry washcloth or muslin. Infection to your baby's belly button is usually preventable so long as you follow all of the tips that I've just mentioned. However, if you notice that your baby's navel area looks red, inflamed, or is oozing a yellow or green discharge, which could be smelly, contact your doctor straight away. They'll probably want to see your baby and possibly prescribe them some antibiotics. If you notice that your baby's navel area is bleeding, apply some mild pressure to the bleeding with some sterile medical gauze and then consult your maternity care provider for further advice. I hope you found this video useful and informative. If you've got any questions about umbilical cord care, please leave me a message in the comments section beneath this video and I'll get back to you as soon as I possibly can. And if you're watching this video and you're pregnant, you may be interested in signing up to my next free hypnobirthing taster session on Zoom. I run 2 every single month and you can enroll in the next one by clicking the link to my website in the video description below. Take care and see you in my next video.